Welcome back to Wally's nursing videos. Today, we will discuss the pathology of atherosclerosis. Atherosclerosis is a chronic progressive disease characterized by the buildup of plaques within the arterial walls, leading to the narrowing and hardening of arteries. This process can impair blood flow and result in various cardiovascular problems, including heart attacks and strokes. Here's a detailed look at the pathology of atherosclerosis. 1. Endothelial injury. The process often begins with damage to the endothelial cells lining the arteries. This can be caused by factors such as 1. Hyperlipidemia, elevated levels of LDL cholesterol, low-density lipoprotein in the blood. 2. Hypertension, high blood pressure which exerts stress on the arterial walls. 3. Smoking. Tobacco smoke contains chemicals that can injure endothelial cells. 4. Diabetes. High blood sugar levels can contribute to endothelial dysfunction. 2. Lipid accumulation. Following endothelial injury, lipoproteins, particularly LDL cholesterol, penetrate the arterial wall and become oxidized. Oxidized LDL is more likely to trigger an inflammatory response. 3. Inflammatory response. The oxidation of LDL cholesterol attracts immune cells, especially macrophages, to the site of injury. These macrophages attempt to engulf and digest the oxidized LDL, but they often become overwhelmed and transform into foam cells due to excessive lipid accumulation. 4. Formation of fatty streaks. Foam cells accumulate in the intima, the inner layer of the arterial wall, leading to the formation of fatty streaks. These streaks are early signs of atherosclerosis and can be seen in the arteries of young individuals with risk factors. 5. Plaque formation. As the disease progresses, the fatty streaks evolve into more complex atherosclerotic plaques. The plaques are composed of 1. Lipid core, a central area filled with dead foam cells, oxidized LDL, and other lipids. 2. Fibrous cap, a layer of smooth muscle cells, collagen, and elastic fibers that covers the lipid core and helps stabilize the plaque. 6. Smooth muscle cell proliferation. The endothelial injury and ongoing inflammation trigger the migration and proliferation of smooth muscle cells from the media, middle layer of the artery, into the intima. These smooth muscle cells produce extracellular matrix components, contributing to the formation of a fibrous cap over the lipid core. 7. Plaque growth and complications. As the plaque grows, it can narrow the arterial lumen and restrict blood flow. Several complications can arise. 1. Plaque rupture. The fibrous cap may become thin and rupture, exposing the thrombogenic core to the bloodstream. 1. This can lead to the formation of a blood clot, thrombus, that further occludes the artery. 2. Thrombus formation. When a plaque ruptures, platelets adhere to the exposed material, leading to the formation of a thrombus that can block blood flow, resulting in acute events such as myocardial infarction, heart attack, or stroke. 3. Calcification. Over time, calcium can deposit in the plaque, leading to further arterial stiffness and reduced elasticity. 8. Clinical manifestations. The consequences of atherosclerosis depend on the location and severity of the arterial blockage. Potential outcomes include 1. Coronary artery disease. Reduced blood flow to the heart muscle can cause angina or heart attacks. 2. Cerebrovascular disease. Reduced blood flow to the brain can result in transient ischemic attacks, TIAs, or strokes. 3. Peripheral artery disease. Reduced blood flow to the limbs can cause claudication, pain during walking, and, in severe cases, lead to limb ischemia. 9. Resolution and management. Management of atherosclerosis focuses on reducing risk factors, controlling cholesterol levels, and managing blood pressure. Lifestyle changes, medications such as statins, and procedures like angioplasty or stent placement may be employed to prevent or treat complications. In summary, atherosclerosis is a multifaceted disease involving endothelial injury, lipid accumulation, inflammation, and plaque formation, leading to potential cardiovascular complications. Understanding its pathology is crucial for effective prevention and treatment.